Hi everyone, I am Dr. Niranjan, consultant nephrologist and a specialist in internal medicine. Today I will be showing you how exactly we need to measure the blood pressure and what are the standards we need to follow when we are measuring blood pressure. So normally we measure blood pressure using the mercury sphygmomanometer, that is the gold standard device to measure the blood pressure. However, because of the prevalence of increasing chronic mercury poisoning, we are discouraging the mercury sphygmomanometers and routine. This is aneroid blood pressure device, and this is the digital, fully automated digital BP apparatus, which work according to the oscillometric method. Before measuring the blood pressure, we need to ask few questions to the patient, and then only you should go for a measurement. Number one, the patient should not have been smoked 30 minutes before. You should not have taken any caffeinated drinks like coffee. And he should not have any urge to pass urine. He has to pass urine and then come into the office or clinic or home. So if anybody has an urge to pass urine in full bladder, the BP may go as 30 to 40 millimeters high, it may show. So one has to empty the bladder and should be comfortable, and then he is to come to the office or clinic before measuring blood pressure. And the other important thing is he should be comfortably seated. Should not have been done the physical exercise, or sometimes the patients or the person who will get the measurement of BP will just rush into the office or a clinic and BP will be very high. So he should be in a comfortable position at least 5 minutes before measuring the blood pressure. He should be seated in a chair which has a back support like this properly, yes, back support like this, and he should have the both foot should touch the ground. Should have seated like this, both foot should touch the ground, and he should comfortably giving the support of the backrest, and he should be the height from the chair and as well as the table should be at least 25 to 30 centimeters. Okay, that should be the norms. And he should not be putting the crossed legs. The legs should be fully separated and foot should touch the ground, and it should be quite comfortable at least 5 minutes before measuring the blood pressure. So let me measure the blood pressure using the oscillometric method, that is fully digital automated blood pressure, which anybody can measure at home. Even the patients or the person suffering from a high blood pressure can measure the BP at their home. So the steering should be at the medial side, and also the bladder should have this complete circumference, at least 80 to 100% of the arm should be covering, and the width will be, the bladder fluid should be at least 50%. And this arm should be fully relaxed and placed over the table, and this arm and also should be placed comfortably over the table. And it should sit properly with the back support, fully relaxation, both foot touching the ground. This is the optimal way of measuring blood pressure. And when you are measuring with the aneroid blood pressure, you need to keep it in mind that at least 2 finger breadth, 2 to 3 centimeter length should be there to put the stethoscope to measure the blood pressure. Whereas a digital BP apparatus monitoring, that is not required, because automatically it will measure, need not use the stethoscope. So we have to switch on the device, and after the patient being comfortable, and it will take the measurement both systolic and diastolic and give the values. So we need to check the blood pressure not only in one upper limb but also in the opposite upper limb. And also you need to keep it in mind when you are measuring blood pressure, the person who is getting blood pressure measurement or the doctor or the person who is doing it should not speak. Many times our patients keep on telling their complaints when you are measuring the blood pressure. The blood pressure will be very high during that time, as high as 40 to 50 millimeters of mercury. So the patient should be quiet, and also the person who is measuring should be quiet. Then the test should be repeated not only at one upper limb but also in the opposite upper. The blood pressure with a high reading we should take into the account, and that is the normal blood pressure. Like that we should need to measure at least 2 to 3 times, and you need to take an average blood pressure and then you need to confirm. See the blood pressure now, the digital apparatus is showing his blood pressure is systolic 123 and diastolic is 77, and the pulse rate of 65 beats per minute. So hope this video will help everybody. Thanks for watching. Hope the same thing can be continued at home, and then come to me to show you the pressure during the follow-up at my clinic. Thank you.